from 55 KRC, the talk station.
848 to 55 KRC, the talk station. I love when the doctors from OHC are in studio to talk about cancer, because one thing in this divided world that we all can collectively agree on 100% without hesitation, cancer sucks. Without further ado, and I know OHC has been doing clinical trials for a long, long time, and I've learned a lot about clinical trials from the doctors that I've talked to over the years, and apparently this is the first place to start, not the last. Clinical trials are how the folks at OHC and cancer researchers find better treatments that are the vital step in providing cancer patients hope. And joining me today in studio, OHC's Dr. A.G. Galal. He's a medical oncologist and hematologist and director of stem cell transplant and cellular therapy, here to discuss why clinical trials are a vital part of treating cancer. Welcome to the 55 KRC Morning Show. It's a real pleasure to have you here, Dr. Galal.
Good morning. Thank you very much
for
being here.
It's my pleasure. All right, the benefits of being in a clinical trial. First off, what exactly is a clinical trial? Just boiled down to its barest terms.
Clinical trial is different stages of testing a new treatment. So we start with phase 1, phase 2, phase 3. Phase 1, we're testing the safety of the product. Phase 2, we're safety and efficacy, and stage 3 or phase 3, we're actually comparing it with the standard of care. So there are many, many steps for the clinical trials or the product to make it to the market and to be available for the patients, to make sure it's safe, effective, better than what we have currently.
All right, so I would imagine stage 1 and 2 confirm that it will directly address the cancer issue. And then the stage 3 clinical trial is to determine whether it does a better job than the previously recommended standard of care.
Correct. And I'll be honest with you, with the preclinical work, we know it's safe, we know it works, but we have to prove to FDA and everyone and to patients that really it does that on a real life issue.
All right. So the hopeful benefit of being in a clinical trial is you're going to get at least as far as the prior standard of care, but the hope is it's going to do a lot better job.
Better job, less side effects.
Oh, you're in my wheelhouse now, sir. These side effects. How does OHC handle cancer research for their cancer patients, at least insofar as the clinical trial area is concerned?
So honestly, in my practice and my colleagues' practice, we offer patients clinical trial in every stage of the disease. So front line, second line, third and fourth line, we have clinical trials that covers all these bases. And the advantage of that, you're getting actually the new technology and the treatment that in the current situation, it's going to be in the future standard of care. And that happened with CAR T. If you go back 7 years ago when I was starting that program at Duke, we had really clinical trials. That's all what we had. But shortly after, we have it as a standard of care. And now we call it cure for patients with lymphoma. So you can see actually the evolution of clinical trials becoming the standard of care. The advantage of having clinical trial early on, you're getting the new technology. You're actually helping other patients by proving that this works.
Yeah, if you want to be altruistic, that's a place to be.
Absolutely. And basically, you're benefiting your disease. So these therapies most likely not chemotherapy. They are more target therapy or immune therapy. That has different side effects and less side effects than the chemotherapy that hits everything.
Well, being a medical oncologist and hematologist, you did just mention lymphoma. And tell me a little bit more about blood cancer program at OHC and how you're helping patients, because I'm one of them.
Well, lymphomas is part of the hematological malignancies that we deal with. Our program is actually a complete program, comprehensive, that does stem cell transplant, CAR T, immune therapy, and basically the basic treatment of the hematologic malignancies, including lymphoma, myeloma, acute leukemias, chronic leukemias. And we see also benign hematology, so patients with anemia that's not known why, whether iron deficiency or B12, patients with bleeding disorders, we see that as well. Patients with clotting disorder, we see that. And we're quite, advanced in our approach to these kind of things, given the research that we're doing. Given the experience that we have in our group, I think this is a lot to speak about.
Oh, I would imagine so. What are the newest trials you have going on that people need to know about along these lines, Dr. Galal?
So we have actually multiple exciting trials. One of them is actually a very new approach to breast cancer. So triple negative breast cancer that's metastatic. We have a BRIA-cell, which is a new clinical trial of allogeneic CAR T, meaning CAR T coming from a different donor. And this is just amazing to have CAR T invading the space of the solid tumors, because most of the time it's for hematological malignancies, but now we talk about solid tumors. We also have for acute leukemia a new trial coming in, and it's not only acute leukemia, it's the acute T lymphoblastic leukemia, which is rare kind of disease, but the treatment for it, the standard treatment, most of the time is not that effective. So having a CAR T in that kind of space is extremely important.
Well, the doctors that have come in and preceded you, Dr. Galal, talk about CAR T. I hate to be so bold in stating it. You can certainly temper my optimism. It sounds to me like it is going to be the magic bullet for many, if not all, cancers down the road.
So I'm going to add to that, actually.
Double down. Go ahead.
Absolutely. So when you look at the CAR T, what we're doing today is going to be different in 5 years. It's going to be CAR T still, the same concept. But what we're doing with the CAR T itself as a construct is just amazing. We're hitting different engines. We're hitting different pathways. We're having less side effects. We're having the allogeneic CARs, which is coming not necessarily from the patient. So we don't depend on the immune system that's been beaten up.
Yes.
We depend on a normal immune system to bring to the patients and modify that to fight the disease. So honestly, we're going to see evolution of the CAR T, and I think you're absolutely right. It's going to be the name of the game.
So if I can maybe rephrase it, again, correct me if I'm wrong, currently it's bespoke. Each individual patient has a CAR T therapy designed specifically for them. Someday, you're going to get a box off the shelf.
Absolutely.
Oh.
And we're doing that currently in terms of, off the shelf. And I think that's a great term because the manufacturing time of CAR T takes average of 3 weeks. But with the allogeneic one, that's off the shelf, literally.
Oh, my God.
So
that's exciting stuff right there, Dr. Galal. And this is the kind of thing someday you're going to come in here and you're going to say, it's done. Yeah. Got it. Yeah. We beat cancer.
Looking forward.
All right, clinical trials, OHC, that's what it's all about. Be there, be altruistic, but also be in the cutting edge of cancer research. Listen, I'm a patient. I'm happy to have them in here and support with the work that they're doing, but they give me wonderful treatment. So to learn more about OHC, cancer treatments, a second opinion, and learn about the clinical trials that probably are available for you at OHC, visit ohcare.com, ohcare.com, or give them a call at 888-649-4800. That's 888-649-4800. Dr. Galal, exciting stuff. Thank you so much for coming in and talking about listeners with me today.